All right, so I just got back from my whole body scan, and the doctor was scheduled to call me at 4:30, and so just called and gave me the results. And they did find cancer in my bed again, in my thyroid bed. They said it was like a big dark chunk. And the weird thing is it was like on the opposite side as than they expected. And so they are planning to change my treatment. So instead of going in tomorrow at 9:30 and getting 30 MCIs of the radioactive iodine, I'm now going to go in at 1 because they don't just, it's nuclear medicine stuff, so they don't just like let it sit there because it decays and it's very expensive. So they try to just make up just what they need, maybe slightly more, and they're upping me to 75, which is over double. Yeah. And so they need to have time to make that up, and so they're going to bring me in at 1. So that's great that they found what they were looking for and that they're going to up it. But here are some thoughts that I have. So 4 years ago, I originally had cancer. And 2 years ago, before I got any results from a test or anything, when I went in, she asked how I felt. And I told her for like the last month, I was getting a lot of symptoms, like when I first got cancer, and I could like feel it in my throat. And she kept reminding me that, the size that I'd had before, you can't really feel it in your throat. And I said, call me Princess and the Pea, because I feel something in my throat. And I feel there is, and maybe it's just a nodule. Maybe it's not like anything bad or anything. It's just, or maybe it's something else. But I feel something different. I have a cough like that you get. And it's just like I was feeling more tired, and I could tell there was something different. But she did find, and then come to find out a month later, I had my originally, like every 6 months after you have thyroid cancer for a while, you do these checkups where you get an ultrasound in your neck to look how things are going, and you get a thyroglobin panel blood test and everything. Your TSH is checked about every 6 weeks. And so my results showed that 2 years ago, 2 years after my original thyroidectomy and diagnosis, that yes, a little tiny something showed up, and my thyroglobin went to 2 or something. There was a 2 in the number, like a less than or greater than 2 of whatever it was. So that caused concern for me. So I said at that time, when I first got my thyroidectomy, you offered to give me a radiation scan or radioactive iodine scan or treatment. And I refused at the time because I was kind of in the gray area of needing it. But now I feel like something's going on and I want to do it. And she said, well, actually, procedures have changed. We don't just automatically give it to you anymore. It's a pretty intense treatment. You don't want to do it unless you really need to, unless it really is urgent or that you really need it. So I would suggest that we wait a little bit and watch this. And so I was like, she's been a great doctor. Okay, yeah, I'll wait, because I don't want to do it if I don't have to, because it does have bad side effects. You can get cancer, you could lose your taste buds, or not taste buds, but your sense of taste. You can get a metallic taste, all these things, of course, that you don't want. So I was like, okay, so we scheduled the next ultrasound for 6 months. It didn't seem to grow, and then something strange. My thyroglobin went from 2 to 1. That said, my medical center changed who they did testing through, and so I felt like maybe it was like a testing error. But again, she said it didn't really grow anymore, so let's keep watching it and see what happens, because it seems to, who knows, it doesn't necessarily mean it's cancer just because something's there. So meanwhile, I'm still feeling like I have symptoms and stuff, but okay, like I don't want to be paranoid either, and like, power, because I could be aggressive and like, no, I want this, but I want to listen to reason too. And so I was like, okay. So we did another 6 months, and I believe at that like year that mark is when it grew again. And that one was kind of a big chunky one, I think. Like, I mean, it grew a substantial amount that it kind of caused her to go, oh, maybe. And I said, so should I get the radioactive stuff? And so she's like, it's not 100%. And again, we don't really suggest that. I suggest, like, I can't remember what the whole situation was, but basically what we did was we were gonna, because my thyroglobin was fine and other things were kind of fine, we were just gonna, again, kind of keep watching, but we're gonna schedule a biopsy. So this is maybe now I don't know, we're all in the mix, but it was about probably 6 months from today, previously, that they did order a biopsy, and not just it was a fine needle, but it was like one where they had to like put me out for, but not 100% out, but you know, like where you're awake during it, but you don't care what's going on, that kind of out, if that makes sense. I get all the way into the surgery room. I am on the happy drugs, and they try to find it with the ultrasound, and they're struggling to find it. Now I'm thinking maybe because they were expecting it on one side and it was on another. I don't know. But they were looking for this thing and they could not find it. And they said, it looks like maybe just an imaging artifact. It's probably not anything. And then there was also, oh, that's what was on my like previous ultrasound. What got her to give me a biopsy was they did find a couple, like 1 or 2 sketchy lymph nodes, which I think this is like a swollen one that's kind of permanently been like that for a while. And so they were checking that. So he said, I could possibly, like the jugular is in the way and it's butted up against your esophagus, so it's like a risky move to test it, and it looks like an imaging artifact that I'm thinking we shouldn't do it. And but I can do a fine needle aspiration of the lymph nodes and see if there's anything. So to be honest, I still felt there was something there, but I had no this doctor did not seem very competent. He was very kind of klutzy for a surgeon. So I didn't want him to touch me. So I was good to put it off. And he did the fine needle thing. And, I really don't have confidence that he actually hit a lymph node, honestly. So maybe he did, but the results came back as the lymph nodes were fine. There was no cancer found, but it was inconclusive because, they didn't find, they weren't able to get into like the thyroid bed that day. So again, she's like, I think we should wait. And again, I said, I really want to do the radiation therapy. I think that would be a good idea. It's been so ambiguous. And again, she talked me out of it and said, let's just wait 6 months. Like, let's just see how things are. And I was like, I don't want to, I don't know. I wasn't 100%. So I was like, okay, we'll do one more. I'll do one more, like, wait and like see what happens. But I know it's a serious thing. It's so inconvenient in life to like put on hold your life for an entire month. And it's not just my life, but my family's life. And so I was like, oh, I'll think about it. Like, okay, but I was going to think about it. A couple days later, she calls me. She goes, I'm so sorry. I didn't have the images that they had produced when he had done the surgery to like go off of. And now that I'm looking at him, I can kind of see a little concern. So why don't we schedule an ultrasound in 4 weeks instead of in 4 months, maybe it's 4 months, a couple months, 4 weeks, I don't remember. But instead of doing 6 months, let's do it in a short time from now. And if that still, if it looks like something shows up, then we'll move ahead with a radioactive treatment. And I said, okay, sounds good. Get to the ultrasound, and I think it had shown that it had grown again, but again, my thyroglobin looked normal, stayed at 1. So then we did the whole scheduling for for doing the radioactive iodine. And here's like where other things, like, okay, so then, so what the plan was is I was going to have my radioactive treatment. I was going to have like the tracer dose of the RAI stuff. So just a small diagnostic amount, and then was going to do a scan, and then based on that scan would be whether I actually did a treatment or not. So that was my doctor's plan. And mind you, I just want to say, I really do have a good doctor. I feel she did really well given her information and what she's about, and treating like the patient and like taking in all the things that she has to consider as a doctor of multiple people. But I say, for us as patients, we need to sometimes respectfully take charge of our own, like, we know when there's something wrong, and we know when our bodies aren't acting the same, and I'm very in tune with it. Like, she'd ask, well, you're okay, like, you don't feel any symptoms. And I was like, no, I still have symptoms, like, I feel like a lump in my throat. And she goes, well, by that size, there's no way you would feel a lump. Well, sorry, call me Princess and the Pea, but I feel a lump. And same with when I originally had cancer, they told me there's scientifically no way you could have felt that. Okay, well, I did feel it. And so, so I wanted to do something about it. So I told her, I called her a couple of days later, or messaged her, I think through the messaging thing with the medical center. And I said, you know what, regardless of how it shows up, because I know that there can be sometimes a false negative, I want to have the ablation regardless, because I know there's something going on in me and I want to take care of it. And I want to make sure that I'm doing what I feel is best. And she said, no problem, totally understand, we'll do that. So we'll just plan to have it. In fact, it's kind of inconvenient to have the scan ahead of time, so we can just skip that altogether and we'll go straight to the ablation. Like, so you'll do the I guess I would skip the tracer dose and the whole scan, the whole body scan, and I just go straight to having a scan, an ablation scheduled, and we'll make that at 30 MCI. I think it was MCI. Now I'm mixing up numbers. I think it was MCI. Yeah, so we'll do 30. And I was like, 30 sounds low. Is that gonna, be okay? And she said, well, new research has shown that 30 is having the same results as 100, so it should be completely fine. I was like, okay. But then I'm thinking, in my head, like, what if there is cancer and I need more than just the 30? Like, what if they find more? What if they found that it's spread or something? So I don't really like the idea of skipping the scan because of convenience. Like, I don't want to be convenient. I want to knock this out. I want to see what's wrong. I want to make a dose based on my actual results. So I went back and was like, you know what? I am not comfortable not having that scan. I don't care that it's inconvenient. I'll take the inconvenience. Please give me a scan, because I want that baseline. I want to know if I'm fighting an actual cancer, or if I'm still at the stage of being proactive to keep it away. So she's like, okay, no problem, not a big deal. So then today I have my whole body scan and just got the results, and there's the very dark piece in there, they upped my dose to 75 and changed my appointment, because they don't just hold, you don't just hold this stuff on hand, because it decays rapidly and it's very expensive to make. So if you have it for a long time, then you're wasting money. So they have to be able to make it. So they had to change my appointment from 9:30 to 1. But here's my little dilemma now is, she's saying 75, and I want to know, would 75 really knock out whatever's there? And I questioned her, is 75 really enough? And she hesitated. But it sounds like they're going to struggle to get that amount. So it's like, do I press and ask for more, or do I do I go with the 75? Because it is pretty serious business. The higher you go, the worse chance you have for side effects, and they're serious permanent type side effects of, you can get another cancer, you can get leukemia from it, you can lose your taste buds, you can gain a metallic taste in your mouth for months to a year to, I don't know if it's forever, the metallic part, but you can lose your taste forever, which I cook, and I'd be so sad to lose that. So right now I am planning just to go for the 75 and pray that it's enough to do what it needs to do. And I just reiterated, I really wanted to kick this one out of the park. I don't want to take too much that I'm stupidly just taking more than I need, but I don't want to barely take enough just to kind of squeak by, because that's all the hospital has. So that's kind of where it is tonight. I'm scheduled to go in tomorrow. Hopefully the right decision is made, and that's my update for now.